Zileuton Tablet, extended release multiphase 12 hours is used to control and prevent symptoms caused by asthma, such as wheezing and shortness of breath. It helps you maintain your normal activities and cuts down on time lost from work or school. This medication must be used regularly to be effective and should not be used to relieve sudden asthma attacks. If an asthma attack occurs, use your quick relief inhaler as prescribed. It is not recommended for use in children younger than 12 years due to possible risk of liver problems. Be sure to take this medication at the same time every day and follow your doctor's instructions carefully. Before you start taking Zileuton, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with food, usually 2 times daily, within 1 hour after the morning and evening meal. Swallow the tablets whole, and do not crush, chew, or split them. Use this medication regularly to get the most benefit from it, and take it at the same times each day to help you remember. Keep taking this medication even if you feel well. Do not increase your dose, use this drug more often, or stop using it without consulting your doctor first. If your asthma symptoms worsen or if you are using your quick relief inhaler more than usual or more often than prescribed, seek medical help right away. If you experience nausea or diarrhea while taking Zileuton Tablet, extended release multiphase 12 hours, it's important to notify your doctor or pharmacist. It's also important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. While many people do not experience serious side effects, it's crucial to inform your doctor immediately if you experience symptoms of liver disease or any mental/mood changes. Additionally, while very rare, it's important to seek medical help right away if you notice any signs of a serious allergic reaction. If you notice any other effects not listed here, make sure to contact your doctor or pharmacist. Before taking Zileuton, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It's important to discuss this with your pharmacist for more information. It's also important to inform your doctor or pharmacist about your medical history, especially if you have liver disease or use alcohol. If you are planning to have surgery, it's crucial to let your doctor or dentist know about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that older women may have a higher risk of experiencing liver problems while using this medication. If you are pregnant, this medication should only be used when clearly needed. It's essential to discuss the risks and benefits with your doctor. It's currently unknown whether this medication passes into breast milk, so it's crucial to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Zileuton Tablet, extended release multiphase 12 hours. This medication can slow down the removal of other medications from your body, which may affect how they work. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Some examples of affected drugs include fezolinetant, pimozide, among others. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, they should call 911 immediately. Otherwise, they should contact their local poison control center right away. In the US, residents can call 1-800-222-1222, and in Canada, residents can call their provincial poison control center. Remember, do not share this medication with others. Be sure to keep all medical and lab appointments, as your doctor may want to conduct tests while you are taking this medication. It's also important to avoid substances that can worsen breathing problems, such as smoke, pollen, pet dander, dust, and mold. And always consult your doctor for more details. If you forget to take a dose, just skip it and take the next dose at your usual time. Do not take double the dose to make up for the missed one. Make sure to store this medication at room temperature, away from light and moisture. It's important to keep it out of the bathroom and out of reach of children and pets. When it's time to get rid of it, don't flush it down the toilet or pour it into a drain unless you're told to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to discard it when it's expired or you no longer need it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.